Okay, hi, my name is Lucia and I'll be your nurse today. I'm going to be teaching you how to change from your large bag to a leg bag. So the pros of a leg bag is that you can be more mobile throughout the day, but remember this is mainly for like morning time or in the daytime use. And so first thing you're going to want to do is wash your hands. If you need an indicator for how long you should be washing your hands, just sing the song Happy Birthday. Then you're going to first start off by emptying your large bag into the toilet, and then you're going to grab an alcohol wipe and clean around the connection, so like that. And then you're gonna want to place a towel or something underneath the connection to catch any dripping that may come when you're disconnecting it. Next thing you're gonna do is you're gonna want to kink the tubing like this, and then you're gonna want to twist it like that. You don't want to tug or pull on your tubing because it could damage it. And then next thing you're gonna do is grab your leg bag, and then you're gonna connect it like that. Okay. Now, it's really important that you keep this below your bladder level. So on the lower thigh or lower leg, we recommend it to be just a little lower so that even when you're sitting, it avoids being at the same level of your bladder, which is really important. So I'm gonna do this. Alright, so you're gonna be discharged with that, and you can adjust it to whatever is comfortable for you. And if you have a difficult time pinching the catheter, please do not use any other clamps. You can request for a blue clamp that is specific for this urinary catheter tube so that it doesn't damage the tube. Next thing you're going to want to do after you've attached the straps, you're going to want to clean your large bag out with soap and water and then hang it to dry. And then, because the leg bag is a lot smaller than the large bag, you're going to have to change it more frequently. So when it's 1/3 or at least half full, you're going to want to empty it to just prevent backflow because that can introduce bacteria. And then lastly, you're going to want to replace it with the large bag when it's nighttime, when you go to sleep, just because it's pretty small, and so at night you won't have to change it frequently. And then furthermore, you're going to want to complete peri care. So warm water and soap is going to be very important so that you are not at increased risk for a COTI, which is a catheter.
And then just make sure that you give yourself
associated urinary tract infection. And then some preventions for this would be to complete hand hygiene before and after completing catheter care. You're going to want to make sure that your urine bag is always below the bladder, even at sitting level. You do not want to tug or pull onto your catheter tubing because it can cause damage. And you're going to want to make sure that your catheter tube is free of any kinks or obstructions because it's going to stop the urine from flowing, so anything like twisting or kinks. And then lastly, some signs and symptoms for COTIs would be like burning, pain, bloody urine, fever, and then especially like after you have it removed, if you have any increase in urination or pain while urinating, that may be some signs of COTIs for you after you have your catheter removed. Do you have any questions? Okay, can you please tell me some highlights of the teaching?
I need to make sure it's below the bladder. I need to make sure that there's no kinking. Warm water with soap to wash my hands before and after. Warm water and soap to wash the perineal area. And I should be mindful of the symptoms of a UTI, and I should tell my provider.
Yes, great.